And final shoulder study worth discussing is from Journal of Shoulder and Elbow Surgery. Again, this was actually published in 2024, looking at open Bankart repair plus inferior capsular shift versus isolated arthroscopic Bankart repair in collision athletes with recurrent anterior shoulder instability. And this was a nice, elegant, prospective study from Argentina, big rugby country. And I love this paper because it's very relevant to my practice in New Plymouth with majority of my shoulder stabilization patients coming from rugby background, both amateur and professional. So an open Bankart repair in New Zealand has been extremely common in the past. And this just reinforces that your failure rate is significantly less when you're performing an open stabilization procedure versus arthroscopic. So in this paper, nearly 7% failure rate in open stabilization group and 23% failure rate in arthroscopic stabilization group. So whereas, and this is for all comers, and some of the collision athletes were playing football as well, which yes is collision, but when a similar study done a few years ago from the UK showed for when looking at purely rugby population in teenagers, if an arthroscopic stabilization failure rate can be as high as 50%. So collision athletes we know puts them at super high risk these days. Most of us are not doing just isolated arthroscopic labral repair for these patients. So either you can consider open stabilization. In my hands, that's the best option for the patient. But of course, there are other factors to consider. So if they have a significant Hill-Sachs lesion, to consider arthroscopic labral repair and remplissage. And of course, if there's a critical glenoid bone loss, then bone block procedure is valid. So there are many different ways to manage these high-risk patients. And once again, I think there is a consensus to move away from purely isolated arthroscopic Bankart repair in this group. That was our journal club on 3rd of July, and certainly worth reading these articles. If you have any questions, please contact me.